You know the feeling. You know it before I describe it. You know it before I name it. You know it the way you know the sound of your own breathing, because it has become that familiar, that constant, that woven into the background of your daily life. It starts somewhere you can't quite point to, not your leg, not exactly your back, somewhere in between, somewhere deep in the architecture of your hip, buried under layers of muscle and bone that you never thought about until they started talking. And when they talk, they don't whisper, they scream. A hot, electric, searing line that shoots from somewhere near your spine, curves through your hip like a river of fire, and pours down the back of your leg, sometimes to the knee, sometimes to the calf, sometimes all the way to the bottom of your foot, like someone is dragging a lit match along the inside of your skin. And the worst part? It's not the pain itself, it's the timing, because it never comes when you're ready for it. It comes when you're reaching for something on the counter, when you're stepping out of the car after a long drive, when you're rolling over at 3 a.m. and suddenly your entire leg lights up like a power line that just snapped in a storm. It comes in the middle of ordinary, in the middle of fine, in the middle of a moment that had no business being painful, and suddenly is. You freeze. Not because someone told you to, because your body made that decision without asking you. Your hand shoots out to a wall, a counter, a door frame, a chair, and you stand completely still, jaw tight, breath held, waiting to find out if this is a 3-second episode or a rest of the day episode. And in that moment, that specific frozen, completely helpless moment, you are not thinking about anatomy. You are not thinking about nerves or vertebrae or piriformis muscles. You are thinking one thing and one thing only. I'm going to answer that question today, not with a textbook definition, not with a list of stretches, not with the same recycled tips that every other video has given you while the pain kept coming back. I am going to show you what is actually happening inside your body, in plain language, in real terms. And then I'm going to show you one small adjustment that may change the way your sciatic nerve behaves, not by fixing it, by giving it something it has been desperately asking for every single time it fired. My name is Connell. I study the exact moment the human body shifts from functioning to failing, not in hospitals, not in dramatic emergencies, but in the quiet, accumulated, completely invisible compressions that build up over hours and days until one ordinary movement triggers a response so electric that your entire body freezes. I have spent years inside this space, and what I can tell you with certainty is this: that moment is not random. It is not bad luck. It is not just your age. It is the final frame of a movie that has been playing for hours before you felt anything. And once you see the full movie, not just the final frame, everything shifts. Before we go any further, I need to say this. I am a researcher and a health storyteller. I am not a licensed physician. Everything we discuss today is for educational purposes, to help you understand your own body more clearly and to give you better tools for conversations with your own medical team. If you are dealing with severe or worsening symptoms, loss of bladder control, sudden leg weakness, progressive numbness, that requires immediate professional attention and is beyond the scope of what we are covering here. What we are covering here is the far more common reality, the recurring sciatic flare that shows up, disrupts your life, calms down, and then, just when you thought it was finally over, comes back. That cycle. That exhausting, demoralizing, I thought I was past this cycle. That is what this conversation is about. Here's the first thing you need to understand, and I need you to hear this clearly because it contradicts almost everything you have probably been told. The pain is in your leg. The problem is almost certainly not. Your sciatic nerve is the longest, thickest nerve in your entire body. It begins as a bundle of nerve roots exiting your lower lumbar spine, threads through the deep muscles of your pelvis, passes directly beneath, and in some people, directly through, a muscle called the piriformis, and then travels down the back of your leg all the way to your foot. Think of it as the main power cable running through the walls of your house. When the cable has room, when the walls are straight, the pathways are open, and nothing is pressing against it, electricity flows perfectly. The lights work. Everything runs smoothly. You never think about the wiring. But what happens when something shifts? When a wall settles, when a pipe expands, when something that was supposed to have clearance suddenly doesn't. The cable gets crowded, pressed, compressed, and the signal, the electricity running through it, starts to distort. The lights flicker, the circuits get noisy. Things that were working perfectly 5 minutes ago suddenly aren't. That is exactly what is happening inside your hip and lower back every single time your sciatic nerve fires. The nerve itself is almost never damaged. It is being crowded. Something along its pathway, a tightened muscle, a compressed joint space, a pelvis that has shifted out of its neutral position, is pressing against the cable. And the nerve, which has remarkable patience but a very clear threshold, is sending you the loudest signal it has available to say one thing: I have no room. Give me space. Not fix me. Not replace me. Not medicate me into silence. Space. That is what the nerve is asking for. And that is what most people never give it, because they are too busy treating the place where the pain shows up instead of addressing the place where the pressure begins. Now let me show you exactly how this pressure builds, because this is the part that will change everything about how you think about your sciatic flares. Most people believe that sciatica is triggered by a specific movement. They think, I bent down to pick up the laundry and my back went out, or I turned wrong in the kitchen and my leg lit up. And they genuinely believe that the bend, the turn, the twist, that specific movement caused the problem. It didn't. That movement was the match. But the gasoline had been pooling for hours. Here is what actually happens. You sit down, maybe after breakfast, maybe after lunch, maybe in the car for a long drive. Your pelvis, under the passive weight of sitting, gradually rolls backward. Your tailbone tucks under. The natural inward curve of your lower back, the curve that keeps those nerve exit points open and spacious, flattens. The spaces between your lumbar vertebrae narrow on one side. The deep muscles of your hip, particularly the piriformis, shorten and tighten as they sit in a compressed position. You don't feel any of this happening. That is the critical truth. The compression builds in complete silence. 30 minutes, an hour, 2 hours, the gasoline pools, the pathway tightens, the nerve tolerates and tolerates and tolerates, because nerves are patient. They try to function through the crowding. They keep sending signals, keep doing their job, keep carrying the electricity that lets your leg work, even as the walls close in around the cable. And then you stand up. You stand up from a collapsed, rolled back, hip compressed position, and you ask your entire body weight to transfer through a spine and pelvis that has been compressed for the last hour. The nerve, which has been barely tolerating the crowding while you were still, suddenly has to function under load, under movement, under the full mechanical demand of standing and walking. And that is the moment the threshold breaks, that electric line, that fire from your back to your foot, that freeze in place, grab the counter, hold your breath moment that you thought came from standing up wrong. It didn't come from standing up wrong. It came from sitting in a way that compressed the pathway for an hour, and then standing without releasing the compression first. The match lit the gasoline, but the gasoline had been pooling since you sat down. And here's the part that should fundamentally change how you approach every single morning, every car ride, every movie, and every afternoon in your favorite chair for the rest of your life. You cannot control whether the gasoline pools. It will. Every time you sit, especially as we get older and the structures become less forgiving, some degree of compression will build around the sciatic pathway. That is a reality of human biomechanics that no amount of wishing will change, but you can control whether you light the match. And the match, the thing that converts silent compression into screaming nerve pain, is almost always the same thing: the transition, the moment between still and moving. The moment you go from a compressed, rolled back, tightened position to a fully loaded, weight-bearing walking position without preparing the pathway first. That transition is where sciatica lives. Not in the sitting itself, not in the walking itself. In the moment between them, when the nerve is most vulnerable, most crowded, and most likely to fire if the pathway isn't opened before the load is applied. Which brings us to the adjustment. And I want you to feel this, not just hear it. Right now, wherever you are sitting, I want you to notice your pelvis. Is it rolled backward? Is your tailbone tucked under? Is your lower back flat against the chair? For most people, especially after sitting for more than 15 minutes, the answer is yes. And if the answer is yes, then right now, at this exact moment, your sciatic pathway is compressed. The gasoline is pooling. The nerve is tolerating. And if you stand up from this position without preparation, you are lighting the match. So don't stand up yet. Instead, do this. Slide forward to the front edge of your seat. Place both feet flat on the floor, directly under your knees. Now, and this is the critical moment, gently tilt your pelvis forward. Not dramatically, not forcefully, just enough to feel a small, natural curve return to your lower back. You will feel your sitting bones press more firmly into the seat. You will feel your chest open slightly. You will feel the weight shift from your tailbone to the front of your pelvis. Do you feel that? That small shift? That tiny change in the geometry of your pelvis? That just opened your sciatic pathway. The spaces between your lumbar vertebrae, where the nerve roots exit, just widened. The piriformis muscle, which was shortening and pressing against the nerve, just lengthened slightly. The entire corridor that your sciatic nerve travels through just became more spacious. You didn't take a pill. You didn't stretch aggressively. You didn't crack anything. You simply changed the angle of your pelvis, and that changed the internal geometry of everything above and below it. Now, from this prepared position, lean forward slightly from your hips, not your waist, and stand. Smoothly, without twisting, without jerking, without lunging. That is the adjustment. That is the difference between lighting the match and keeping the gasoline from ever igniting. Now let me tell you why this matters more than you think. Because the adjustment I just showed you is not a one-time trick. It is a pattern interrupt. It is a way of breaking the cycle that has been repeating itself in your body for weeks, months, maybe years. The cycle of compress, ignite, suffer, wait, compress, ignite, suffer, wait. Every time you use this adjustment before standing, you are doing two things simultaneously. First, you are giving the nerve space at the most vulnerable moment, the transition. Second, you are sending a message to your nervous system that says, the emergency is over. The pathway is open. You can stand down. Because here's something most people never realize about chronic sciatic flares. After the first few episodes, the pain is no longer purely mechanical. It becomes neurological. Your brain starts anticipating the pain before it arrives. It starts bracing, guarding, tightening the muscles around the nerve, the very muscles that are already compressing it, in a misguided attempt to protect you from the pain it expects to come. Your nervous system is essentially locking you into a cycle of its own creation. The anticipation creates the tension creates the compression creates the pain confirms the anticipation, and the cycle tightens with every flare. The pelvic adjustment, practiced consistently before every transition from sitting to standing, interrupts this cycle at its weakest point. It tells the brain, through real-time physical feedback, that the pathway is open, that the nerve has room, that the expected pain does not have to arrive. And over time, not overnight, but over days and weeks of consistent practice, the brain starts to update its prediction. It starts to expect the pathway to be open rather than closed. It starts to release the guarding. The muscles that were clenching the nerve begin to soften. The cycle that was tightening begins to loosen. This is not theory. This is the way the nervous system actually works. It updates its predictions based on repeated experience. And every time you give it the experience of a pain-free transition, you are rewriting the prediction that was keeping you trapped. Now I want you to think about something uncomfortable. Think about every morning this week. How did you get out of bed? Did you roll to one side, plant your feet, and push straight up from a rounded, compressed spine? Think about every time you got out of the car. Did you swing your legs out, twist your lower back, and stand from a position where your pelvis had been tucked under for 20 or 30 minutes? Every one of those moments was a match being struck. And every one of those moments was an opportunity, a missed opportunity, to do what you just learned, to slide forward, to prepare the pelvis, to open the pathway before asking the nerve to handle the load. How many matches have you struck this week without knowing it? How many flares could have been prevented, or at least reduced, if someone had shown you this single mechanical truth about how the nerve gets triggered? That is why this adjustment matters, not because it is complicated, because it is simple. And because simple things, done consistently, at the right moment, have more power to change chronic patterns than complicated things done occasionally. Let me leave you with this. Your sciatic nerve is not your enemy. It is not broken. It is not degenerating beyond repair. It is a remarkably sophisticated communication system that is doing exactly what it was designed to do, telling you with absolute clarity that something along its pathway has become too tight, too compressed, too crowded for it to function without resistance. That message is not a sentence. It is an invitation. An invitation to change one small thing about how you transition from sitting to standing. An invitation to give the nerve what it has been asking for, not once, not as a special occasion, but every single time, consistently, deliberately, as a non-negotiable part of how you move through your day. Because the body does not change in dramatic moments, it changes in the accumulated total of small ones. And this adjustment, this 5-second reset that opens the pathway before the load arrives, may be the smallest, most consistent change you can make to shift your relationship with sciatic pain, from managing it to understanding it. The nerve is not screaming at you, it is talking to you. And now, perhaps for the first time, you understand what it has been trying to say. Give me room, and I will stop giving you pain. I'm John Connell. If this explains something that months of confusion never made clear, leave the word space in the comments right now. And if someone in your life has been living around their sciatic nerve, planning their mornings, their car rides, their evenings around the fear of the next flare, send them this video. Because the adjustment that may change everything is not complicated, it is just something nobody showed them, until now. I'll see you in the next one.